Are you struggling from one of the world's oldest diseases? Hi, I'm Dr. Crockett, and this is Dr. Sanders with Zeal Integrated Health. And over 19 million Americans struggle with arthritis. And we want to talk about just the different types and how it impacts people's lives today.
In fact, there are actually 140 or more different types of arthritis. One of the most common, you've probably heard of it, osteoarthritis. This affects the knees, the hips, the hands, even the feet and ankles. There's also other types of arthritis that we categorize as inflammatory. Inflammatory arthritises can be autoimmune, but for the most part they're inflammatory because they affect the synovial joint capsule. That can happen in any joint in your body. That capsule gets inflamed and causes pressure and pain in the joints.
You bet. So a lot of times some of the treatment is designed to address some of that inflammation, but in the cases of autoimmune disorders where the immune system might be attacking the joint, these are things like rheumatoid arthritis, lupus, you deal with psoriatic joints. Those are just a few of those autoimmune situations where the immune system's attacking the joint and causing the inflammation. So we always want to identify what's driving the disease process. Is it from wear and tear, or is it from something that's maybe internal that's causing that inflammatory process? Really, we want to do this so that we can prevent just the disability that can occur from arthritis.
Yeah, there's a lot of disability coming from arthritis and the different subcategories of it. But also previously injured joints, they're more prone for arthritis. Injury doesn't have to be a traumatic incident. Doesn't have to be a fall. It doesn't have to be a break or a fracture. It can just be from stress. It can be from stresses put on the body through ergonomics at work, whether you're working from home, sitting in a desk all day, or loading pallets at the warehouse.
Yeah, just doing the same thing, that repetitive motion day in, day out is one of the most common things to drive arthritis. So let's talk a little bit about treatment. First of all, we can bring in chiropractic adjustments and work the joint to increase the mobility and the flexibility around the joint. So we want to work on alignment. We want to work on the ligaments and the soft tissue around it so that we can help support that joint in healthy movement. And then a second thing that we like to do here at the clinic is usually we bring in some supplementation to help support the body in the inflammatory process. You can use things like turmeric's been in the news a lot, ginger, boswellia. There's a lot of these types of herbs that can help benefit with inflammation. And of course, then we can bring in some of the physical therapies, strengthening muscles around the joint can help to stabilize that. And then we have to also look at what is the person doing that's causing this. So we want to not just treat that symptom, but we want to identify, well, why is this even developing? Sometimes it's sitting down with somebody and discussing their desk and how it's set up. Where's their monitor at? Maybe if they're lifting a lot at work, what are some things that they can do to lift properly? And a lot of times it's those little conversations that make all the difference in preventing this from continuing to progress and ultimately lead to maybe disability or just decreasing the quality of life. So I hope this brings up some awareness in arthritis and how we can help with that. And remember to subscribe below.